Another one is psychological preparation. In psychological preparation, first we have to do is we have to remain calm and explain each procedure to the patient. Allow patient to feel free to ask questions and mention any discomfort. So in psychological preparation, the patient is undergoing surgery, so the patient will have anxiety. So we should be free to ask, or the patient should be free to ask questions. Okay, and we have to clarify all the doubts of the patient, so the patient will be relaxed. And we can also help the patient to meet another patient with underwent same surgery. Okay, so that may help the patient to uh, what to say, to relieve his stress. Next one, in physical preparation, mainly the skin preparation. We have to shave the area and we have to prepare the area, and then the patient should take bath, and elimination the enema have to be given. Then the food should be restricted before 10 last night. Then the patient should be NPO in the morning, and there will be IV fluids on the hand. We have to insert IV cannula and start IV fluid. Then in case of pre medicines that have to be prepared, and antibiotics test dose should be given. Then all the valuables of the patient should be removed, and the hair, the clothing, the dress, the hospital dress have to wear. Then if any prosthesis is there, that should be removed. Dentures, then ear prosthesis, etc., that have to be removed. Then nail polish, etc., have to be removed. So these all are the things that comes under the physical preparation. Next important thing that we have to consider is pre-operative education. So in pre-operative education, what we have to teach is we have to teach the deep breathing and coughing exercise, pursed lip exercise, then how to use incentive spirometry. Then the in case of breast cancer surgeries, post mastectomy exercises, then cough breathing, then passive and active exercise. All these things have to teach during this preoperative period, and the diet have to be followed in the first week and second week, etc., and which all are the diet that is needed for the wound healing. On the day of surgery, we have to complete the preoperative checklist by patient name, bed number, OP number, IP number, etc. Then we have done the preoperative teaching or not. Then anesthesia consultation done or not. Then ID band. Then allergic history. Then cross match is done or not, availability of blood or arranged blood, etc., the informed consent is taken or not. Then history and physical examination findings, especially special physical examination findings and history, especially CAD, DM, etc., have to be mentioned. Then reports, investigation reports will be there in a CBC. Then other lab reports, then ECG reports, then X-ray reports, and other reports. Everything should be attached with the patient. Then vital signs, the time of shifting, what is the vital signs of the patient. Then NPO status, from which time onwards the patient is in NPO. Then personal care provided or not, the patient personal hygiene is maintained or not. Then dentures are removed, eyeglasses and contact lenses are removed, hearing aid, jewelry, then hair pins, everything has to be removed or not. Then void at last hour, then the presence of pacemaker, etc. Then the chart is completed or not, everything have to be mentioned. Okay, so if we are completing all those things, we can put a tick mark, and will then after giving the pre-medications, especially we are giving the sedations or tranquilizers during prior to the prior to the surgery. So that have to be given before the surgery. Pre-medication, that is very important. Then these all are the things you have to remember while sending the patient into the OT, operation theater. Okay.